getting a taste of the sober life, as many Americans still say they're sticking to a dry January.
Here with advice is Dr. Jean Lambert, an addiction specialist with Mass General Hospital. Doctor, thank you so much for joining us this morning.
Good morning.
Well, as you know, dry January means no alcohol for the entire month. What's the point of doing that?
Well, it all depends certain factors of how much and how frequently one drinks, which could play a role. But in terms of health benefits, for regular drinking, short-term abstinence has been associated with improvement in the quality of sleep and energy. Individuals feel less fatigued, improved headaches. Individuals are able to better concentrate. It also an improvement in their sexual health and functions. But more importantly, the improvements in an individual's blood pressure, individuals lose weight, there's improvement in their LDH or bad cholesterol, improvement in their insulin resistance, which is a risk for diabetes. Overall, there's just an improvement in health. And short-term abstinence can also lead to drinking less if you return to drinking after participating in a dry January.
It's a long list of health benefits there. A good time for a reset in January. Of course, it's not unusual for people to have a hard time keeping their New Year's resolutions. But what if you discover you just can't give up alcohol for 4 weeks?
Yeah, that's a different scenario. And I think it's an opportunity for self-reflection and growth. It allows the individual to examine the role of alcohol in one's life. What's my relationship with alcohol? This may be an opportunity to explore that personal question. What positives do I associate with alcohol in my life? And does that correlate favorably with my overall health and other important aspects, including my professional life and my interpersonal relationships? If there are no positives, then it may be a time to seek help from your healthcare provider or trusted family or friends who in a non-judgmental way can actually have ongoing conversations about why I need to continue to drink and what are the positives or negatives associated with my ongoing drinking.
You've probably heard that some people may experience withdrawal symptoms. Which ones would you worry about?
Well, if we're talking about withdrawal symptoms, you're actually talking about an individual who has alcohol dependence and has been drinking long enough or heavy enough that if they stop drinking, they had developed what we consider an alcohol withdrawal syndrome. And that has a number of symptoms from nausea, vomiting, sweating, high blood pressure, insomnia, anxiety, agitation, rapid heart rate, or tremors or shakes. And if not treated, that can progress to hallucinations, seizures, or severe alcohol withdrawal, which we consider to be delirium tremens, where you're confused, you have high blood pressure, fevers, and require hospitalizations. And then in the most severe cases, even death. If you decide to stop drinking and after having been drinking for a long time or heavily, I would suggest or really advocate you talk to a medical professional about getting medical treatment for withdrawal, not stopping on your own. These symptoms could be so severe that it require hospitalization, and in cases where they're untreated, actually result in death.
Wow, very serious. Thank you so much, Dr. Jean Lambert, an addiction specialist with Mass General Hospital.